So we know that there is a cirrhosis of liver. The next question is, how do you diagnose it? How do you approach towards this case? So as we all know, the first investigation of choice is an ultrasound of abdomen and liver, wherein you may find signs of portal hypertension in the form of dilated portal vein more than 12 millimeter, or you may find collateral. You also may find liver enlargement or shrunken liver with caudate lobe hypertrophy, splenomegaly, and free fluid abdomen, which we call it as ascites. These are common findings on an ultrasound whenever you suspect a patient of cirrhosis of liver. Apart from that, some patients we may find a small nodule or multiple nodules, which can be commonly described as regenerative nodule as a part of liver scarring and fibrosis, but can as well be a silent liver cell carcinoma. We call it as liver cancer or SCC in the setting of cirrhosis of liver. So as mentioned, first investigation is an ultrasound abdomen. Second is blood test, which includes complete blood picture, liver function test to know the level of protein, total protein, albumin, usually low in liver disease, cirrhosis of liver. Bilirubin may be elevated in patients who have decompensated liver disease. SGOT, SGPT, usually patients will have normal if they have an advanced cirrhosis of liver, but if they have an overlapping alcoholic hepatitis or cirrhosis along with that, then they may have elevated SGOT more than PT. As well, same finding in autoimmune hepatitis. The third investigation which we do commonly to establish the stiffness of liver, to determine how much is the fibrosis of liver happening, is liver elastography. This is a very, very important investigation. We also come to know by doing this test the scoring of stiffness, and based on the score we come to know that what stage of the liver disease the patient has come to us. So it many a times help in avoiding gold standard investigation, liver biopsy, by doing the liver elastography in many of the situation. Having said so, the fourth investigation, which is reserved and to be used in few percentage of patient, is liver biopsy. In liver biopsy, what we do, there are two methods. Basically, one we do percutaneously liver biopsy, ultrasound guided, and the other way is that we can do either endoscopic ultrasound guided or a laparoscopy guided. Based on the coagulation parameters, based on the overall condition of the patient, we decide which method is better than other. Whatever it is, the liver biopsy still remains an important investigation for confirming the diagnosis. Other investigations which are done to diagnose the liver disease and its complications are basically to know the reasons for developing liver disease and to know the complications of liver disease, which includes hepatic wedge pressure gradient estimation. That's an invasive test. We also do in some patients the endoscopy to know whether they are developing esophageal varices, whether they have developed the vessels inside the food pipe which can rupture and which can cause blood vomiting or black motions, which is very common. So an endoscopy is an important diagnostic tool to confirm the liver disease, cirrhosis of liver. Apart from that, we also do other investigation which are in the form of blood, like autoimmune profile, serum ceruloplasmin, alpha-1 antitrypsin. We do serum iron, ferritin, TIBC, other viral markers, hepatitis B, hepatitis C. Last but not the least, which is very important, that we need to know the liver parenchyma, liver structure. So it has been of late proved that CT scan, plain CT scan abdomen in a doubtful case is much superior to an ultrasound abdomen to know the surface of the liver. If it is an irregular surface with nodules or so, it can be better picked up on a CT scan rather than an ultrasound abdomen. And alpha fetoprotein, which is a very, very important investigation which can rise in patients who have SCC even if the ultrasound is normal or the lesion is less than 1 centimeter.